Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
Welcome back, everyone, to another episode of AMG Vitality Vault Podcast. Dr. B here, and I have with me the socktastic Dr. G.
Oh, you scared me there. She did. I didn't expect her to say that. That's why I'm wearing my Boo socks today. I'm paying homage to Boo from Mario. And, when you get a good fright, Dr. B, your heart races, right?
Okay.
And your blood pressure rises, right? So it's important to keep that blood pressure in check. So here's where we're going today. In this episode, we are looking at the 5 most popular medications for hypertension. Looking at the benefits, side effects, and key considerations you should be thinking of if you are prescribed or someone or your physician is thinking about prescribing one of these for you. So let's get the ball rolling with why should we manage hypertension? Well, to stay alive for one, duh. But high blood pressure increases the risk of heart disease, stroke, and kidney damage. So it's important when you are having blood pressure elevation issues, no matter the cause, when you see your doctor, take it seriously and make the adjustments needed. Effective treatment does help to reduce complications, and obviously quality of life is much better when you don't have, issues with hypertension.
Yeah.
Now, medications, important. It's good to understand how they work, what your options are. So let's dive in.
And of course, we've talked about lifestyle changes that you could address at first.
Of course, yes.
If your blood pressure just starts to creep up, we're not talking about trying to implement lifestyle changes if your blood pressure is found to be 200 over 100, consistently.
Oh, you'll get a lifestyle change if you don't address that.
Yeah. That is something that needs medications right away. But if it's just slowly going up, maybe 140 over 90 or, some, and you need to cut some of your sodium out, lose some weight, be more active, eat more fruits and vegetables, all the things that we've spoken about in a previous podcast, you do so. But if those are not helping, then you need to look at medications. So we're going to start with showing you the most common ones that are prescribed and what to look out for if you are on these medications, and what to ask your doctors about. So first one up is the thiazide diuretics. And these are thought as a first-line therapy, or at least if you look at any of those guidelines that are talking about treatment of hypertension, this is one of the first-line therapies there. The thiazides help to remove excess sodium and water, and that's how they help to lower the blood pressure by lowering the actual amount of volume that's in your body. Of course, if you're lowering volumes, then you have to look out for electrolyte imbalance. So when you're, so they're basically working on the level of the kidney, and so when they push out this sodium, it can actually push out some potassium as well, leading to hypokalemia. Of course, low sodium is called hyponatremia. So just in the way that they work, they can cause low sodium. And hypercalcemia, that's elevation in calcium, as well as elevation in the uric acid called hyperuricemia. And these are all levels that can be monitored on your blood work. So, if you're on a thiazide anti-diuretic. Make sure that you stay hydrated as well. Stay hydrated maybe with some extra electrolytes, and make sure that you are having regular blood work to monitor your kidney function and these different levels.
So next up is our ACE inhibitors, your angiotensin converting enzyme inhibitors. Fancy word, because we're actually looking to augment that enzyme by using these drugs. So when you block the enzyme activity, you help to relax the blood vessels. And when you have a condition like hypertension, what typically happens is there's stiffness or tightening of the arteries. So with bringing in these medications, you kind of help to relax those blood vessels to help relieve some of that pressure. Now, common ones that we know of are like lisinopril, ramipril, or typically anyone who ends in a pril. That's someone who belongs to the ACE inhibitor class. Very common one that we prescribe. You got to be careful with this one because some side effects can be like this persistent dry cough that some patients may be having and not realizing that they have. Now, what we have seen in practice is that the cough doesn't have to happen right away, but it can happen months or even for some patients years down the line. So just be careful. If you're having this unexplained cough and you're on one of these drugs, it's always good to ask your physician, hey, could this drug be causing my cough? And then more investigation would take place. Now, for some people, we have to watch out for their potassium balance. So we talked about thiazides can lower potassium. These can actually increase your potassium. Just be very careful. And some people can actually see some level of renal damage because of these drugs and how they work in the kidney. So they're good, but they're good with caution. Just be very careful. And for anyone who is of childbearing age, any woman who has high blood pressure issues and is wanting to get, pregnant, we always are very cautious as to whether or not we start this particular drug class. It's a good blood pressure medication, but you're always worried about the potential for fetal side effects or abnormalities because of this particular enzyme blocking medication.
And a lot of times the thiazides are combined with the ACE inhibitors because of that potassium. One lowers, one elevates potassium, so it helps there. Next up is angiotensin 2 receptor blockers. They're called ARBs, and what they do is they block angiotensin 2, they block the receptors for that, and it helps to relax the blood vessels. So these are receptors within the blood vessels. And they're similar function side effects as the ACE inhibitors, actually. Yes. So high potassium again and some renal impairment. Now, with both of these drugs, the ACE inhibitors and the ARBs, there is a rare side effect. A very, very small percentage of people have a hypersensitivity reaction called angioedema, which is basically swelling of the face, the mouth, the tongue, and it sounds like it can be definitely detrimental, and it can be, because if you have swelling of the throat that's causing problems with breathing, you need to seek emergent help right away. So if you're on one of these medications and you start experiencing swelling, especially the lips get really swollen, and then the rest of the mouth cavity, and especially if you're having like any wheezing or difficulty breathing, you need to get to the ER right away.
Yes.
And if you do have that reaction to an ACE inhibitor, ARB, then you can no longer use any of those medications in that class.
Do not pass go. Do not collect $200.
So something very important to look out for. But as I said, not very common, but just something to know. And similar side effects, as I said, except for the dry cough. So some people who have the dry cough with an ACE inhibitor may not have that with an ARB. So it's a good alternative to an ACE inhibitor.
ARB. So let's talk about calcium channel blockers. CCBs, these are actual drugs that help by blocking calcium entry into the cells of blood vessels. And this, once again, causes those blood vessels, the smooth muscle in the arteries, to relax. It's all about relaxation. There's a theme? Zen in the blood vessels. Now, with these drugs, they're really good. Some of the common ones that we know of are like the amlodipines, nifedipines, verapamil, a different one. Those are the ones that we typically use in medicine to help with controlling blood pressure. Pretty common side effect, which is usually dose dependent, is swelling of the feet. So some people can see it, and some patients tolerate it really well, but those who don't, we tend to have to transition them off of that drug to something else. Another known side effect of the CCBs can be constipation for some people, but in practice, I haven't seen too much of that side effect with my patients, but what I have seen a lot of is the swelling of the feet, which tends to be, like I said, dose dependent. So the higher we go in the dosage of the medication, the more likely you are to see more and more swelling. And then it all is based on the tolerance, because the swelling really doesn't cause any issues, but some people, their feet feel so tight that we're just going to have to change. But calcium channel blockers work in the blood vessels, cause relaxation by blocking calcium from getting into the cells, and it helps to reduce blood pressure.
Next up, we have beta blockers. This is actually a common class of medications in blood pressure, because it's also helped to lower heart rate. So in people who have elevated pulse rates, it actually helps with that as well too. And it helps with different cardiac dysfunction or conditions. So beta blockers actually helps to block those beta receptors in the blood vessels, again helping them to relax, as Dr. G said. General theme of relaxation in the blood vessels. And so the way they work is lowering blood pressure and lowering heart rate. So they can cause, as a side effect, low heart rate, which we call bradycardia. So if it's below 60 beats per minute, that's when we say, okay, maybe we need to back off this medication or discontinue it, especially if it's causing symptoms of like fatigue. When our pulse rate is low, we kind of feel more lethargic, and just not as vibrant. So it if it's causing symptoms, we need to do something about it. Some beta blockers can also cause us to have some depression symptoms, so we want to be cognizant of that. And sexual dysfunction is very common with beta blockers as well too. So just something to remember if you're on one of these medications. They can also worsen some lung conditions like COPD and asthma. So if you're having more frequent flare-up, if you're a COPD patient and you're on a beta blocker, you might want to talk to your doctor about that. And then down here it says that you could be used in heart failure or post-MI. These are two common cardiac conditions that beta blockers help with remodeling of the cardiac muscle. So that's why I said this beta blockers are actually commonly used in blood pressure, especially if you're having some of the other comorbid conditions, because it could pretty much help with those cardiac, whether it be you had an MI, which is a heart attack previously, or you've got a little bit of a dilated heart or a little bit of a thickened muscle, heart failure. So those are different types of heart failure. Beta blockers is very common, but as you can see, they can cause some other side effects too, albeit that they're not all very common, but just something to look out for.
Yeah, and some of the common ones that we prescribe on the regular are like metoprolol. Most people know that one. Carvedilol. So typically any alols, those are the ones that are pretty much going to be in that beta blocker class. And what's cool is that the newer ones coming out the market are actually more selective to the heart. So the reason why we see a lot of the lung side effects with some of these drugs is because they're not selective. They go after beta receptors everywhere. So the newer ones that we have actually focus primarily on the beta receptors in the heart. So there's
cardiac selective,
cardiac. So those are the good ones to be on if you get into it with your doctor. Have the talk. One thing that we do like to do is when you're prescribing a medication, I like to, and Dr. B as well, prescribe one thing that can take care of multiple things. So if you have high blood pressure with a little bit of elevated heart rate, or let's just say you have some atrial fibrillation or some kind of dysrhythmia, I'll put you on a medication that's going to help with the blood pressure, help control the heart rate as well. So we kind of kill two birds with one stone, because not all of the antihypertensives that we use do multiple things. So it all depends on what we're trying to accomplish. You want to achieve the most with less.
Absolutely. So key takeaways here, thiazide diuretics, effective first-line option, but you got to look out for electrolyte abnormalities. You have your ACE inhibitors and ARBs, both relax the blood vessels. Both have similar side effects. However, the ARBs do not have that dry cough side effect, so maybe a better option if you do have that. Calcium channel blockers helps to relax the arteries. Very effective, but watch out for the leg swelling swelling or edema. And beta blockers, we just spoke about those. They can do many things at the same time, so they may be a good choice for you depending on, what are the health conditions you have. But of course, look out for any side effects that might be bothering you and discuss that with your doctor.
Yes. And also remember, before you go on to that next drug, most times as physicians, we like to maximize what you're on before we add something else. So you don't want to be on a sprinkling of 5 different drugs when you could be on just 2 at the maximum effective dose, minimum effective dose to achieve what we're trying to achieve.
Minimum dosage to achieve. Yes, right. Absolutely. To minimize side effects.
That's right. Because guess what? Side effects, you have to live with them and we have to deal with them. So we don't like side effects. All right, so Dr. B.
Yeah.
Hypertension, medications, most common. Hope you guys loved it.
Yeah, absolutely. All right. Good seeing you guys. Catch you another episode of our AMG Vitality Vault podcast.
Have a great day, guys.
Yes.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.